During the height of the AIDS crisis in the 80s, fear and stigma left countless people silent and feeling isolated. Elia Chino refused to stay quiet, dedicating her life to breaking the stigma and providing support to the community. Today, FLAS Inc. continues that mission, offering free testing, counseling, and resources for National Latino AIDS Awareness Day. And joining us to share more are Elia Chino, founder of FLAS, and Xochitl Calderon, who is also part of the organization. Good morning.
Good morning.
All right. I remember I was in the beginning of my journalism career, and I remember when this thing called HIV/AIDS. In fact, I remember the big newscast where they said we now have a name for it. What are your memories of that time?
Wow.
Yeah.
First, I'm grateful to be here this morning.
Thank you.
Thank you for the invitation. I think that one was the most difficult time of my life, to be involved in HIV prevention and education to the community.
We were losing people.
People was dying in friends' houses and apartments and the hospital.
I know people who were dying in their cars because they had been kicked out of places.
With
right?
no family.
Yeah.
Just friends.
Yeah.
Or by themselves, alone.
Yeah.
That's what I remember.
Yeah,
okay.
because we didn't know how it was spread at the time. There was a lot of confusion, and so it's just a crazy thing. And you've been through tough things before, but not like this, right? You're the 7th of 9 children.
Yes, from a little village from Michoacan, Mexico, with a very big family, very humble family, campesinos, you know.
Yeah, and you immigrated to Houston after high school. What is that? I think a lot of people underestimate what that jump is like. I was in a military family that grew up overseas, and so for me it was kind of a weird transition, but not as tough as some people who are leaving with a different language and the whole bit. What was that like for you?
That one was very difficult because I immigrated because I want to have a better future, better opportunities, and continue my education. Right. That nothing was easy when I moved to Houston. Yeah. It was a start from zero again to do whatever I had to do to have 2-3 jobs to survive. Yeah. But on top of that, the language, the discrimination.
And then being part of the LGBTQ community, right? Because there's a better understanding today. We're still not there yet, but better understanding today. But back then, not so much.
It was a lot of discrimination. It's still, until these days. It's a lot of stigma. We and on top of the HIV epidemic, to be a member of the LGBT community, because at the beginning the epidemic was only for gay people.
Yeah, because in America was a strange case, because in America it did start in the gay community, but around the world it was heterosexual. We had to change people's minds to understand that, no, this is a stereotype, you're stereotyping. HIV/AIDS can affect anybody, as we soon found out. Instead of hiding, you decided, I'm going to wrap my arms around the people who are dealing with this and the community, and work for, one day a cure. We have treatments today, not quite a cure, but treatments today. What made you decide not to hide, but instead to step out front?
When I find out that my best friends die from complications of AIDS, that's when I started, I need to do something about it, I say myself. And the first thing what I did, I went to Bentao Hospital to be a volunteer. When I had the opportunity to have in my arms, the people was dying in my arms, I was able to help them out to go to the bathroom, to pray for them, give them medication.
Human dignity.
They has to take it about 30 pills per day.
Yeah, it was aggressive.
It was a sentence to die. Yeah. Okay, but it really breaking my heart. Okay, to remember those days, because nothing was so easy. I was punished by my own community that I was doing this because I was infected with HIV. Yeah.
And which as we know, at one time when someone said you're HIV positive, that was a death sentence. All right, Xochitl, you're born and raised in Veracruz, Mexico, and as we know, disease, knows no limits. But when you are in an immigrant community, sometimes you have a tendency to hide, right?
Yes.
So why is this program so important?
Well, what I love, and thank you for the opportunity to be here and give voice to all these things that we had to express. The thing that I love working in FLAS is that we only not are there to give the diagnosis to the people that goes there. We accompany them to all the process. We go with them to the first appointment, And then as a Reiki master, I also do sessions like mental health counseling, behavioral health counseling, and also I do meditations, and we go with them the whole way, not only giving the diagnosis.
Yeah. Today it's different. So the good thing is that we have medications that can give people a normal life expectancy, right? However, one of the things we also want to work on is the other. Number one, it's not easy. We also want to work on the front end of this, and that is the education piece for prevention, right?
Yes. Yes, and you assume it is easy.
Yeah.
But
just because you stay alive. Yeah.
But many people, they don't have the knowledge of it. They're still thinking that it will be, like a diagnosis that is easy to deal with. Yeah. And it's not, because many of these clients that come to our organization, to FLAS, they don't have family here. They can even talk freely about this disease, so they suffer alone. So prevention, we really need to work on it.
Yeah.
In education, we really need to let them know this is not a sentence to die.
Yeah.
This is just a new lifestyle.
You have key programs, Reconnect 2.0, support group for gay, bi, and queer men, Transcend Houston, support group for trans women, and then Elia, women's reproductive health program as well. And then you have your mobile unit.
Yes, this project Reconnect is helping out to healing the community, to healing their mind, their body,
and their energy.
And the energy,
The soul, right? Yeah.
The
All
soul.
right. Tell us about your annual health fair.
The annual health fair, every year since 1988, it was established the National Latino AIDS Awareness Day. And this event was established to promote to people to come in now and get tested for HIV, because it's still the stigma and the fear in the community. And this is to unite forces to all the organizations to provide testing in the communities.
Because you got to understand, if you don't do anything, the disease just marches on, right?
Yes.
So
It's 1.2 million people that live with HIV in the United States. In the city of Houston, over 35,000 people living with HIV.
You know what the key word there you just said? Living with.
Yes.
That's the key thing. You can live with it, so you can get the best life out of it when you have the education and the support.
Yes.
Thank you very much.
Thank you so much for your support.